Hi, I'm Dr. Rena Azar, and I'm going to talk today about hormone replacement therapy and how important it is perioperatively and for some other reasons. I'm talking about hormone replacement therapy in the vaginal area. As we get older, and particularly after menopause, the vaginal skin, which is a mucosal skin like what we have in our nose and our mouth, to be different than what we have elsewhere on our body on the outside. It is a soft, moist skin, and in the vaginal area, as we get older, and especially like I mentioned, after the change of life when we have depleted estrogen levels, our vaginal skin gets thinner and drier. That results from the glands underneath the vaginal skin that keep that area lubricated becoming less numerous and less sizable, so they work less and they work less well, so the vaginal tissue becomes drier. It also becomes thinner. And also, very importantly, the blood supply that permeates through the vaginal tissue becomes less. So all of those changes change the vaginal tissue to become something other than nice and moist and compliant or having some flexibility and give. I kind of analogize it to bacon as before it's cooked and after it's cooked. So after the drying out over time, and with the lack of estrogen, that tissue becomes very thin, dry, and avascular. That is not a good thing for healing post-operatively. So I like people to use it at the time of their pelvic floor reconstruction treatment. It would be best to start the medication prior to the vaginal reconstruction, and it's important to continue it afterward. Most cases, I recommend to continue the vaginal estrogen treatment long-term, post-operatively, as in the rest of your life. Maybe not every night or every three nights a week, but maybe every 2 nights a week. In addition to the fact that it's helpful for surgical healing, I think it's really important to understand that when the vaginal skin is healthy and moist, it keeps the bacteria in that vaginal area around our female system, keeps the good bacteria healthy and happy. But when that tissue gets dried out and thin, then the environment in the vagina, which we call a biome, which is a balance of bacteria and other organisms, it makes the biome shift because of the changes in acidity and the changes in the health of the tissues. And our body can no longer fight off the bad bacteria, and the bad bacteria move in and the good bacteria move out. And that makes women much more prone to yeast infections, bacterial vaginal infections, bacterial urinary infections. And these are all important things to ward off as we get older. And that's the benefit of hormone replacement therapy in the vaginal area that we use for vaginal thinning. It can help to decrease the time it takes to heal. It can help to decrease urinary tract infections, vaginal infections. It can help to decrease pain with intercourse. So these are all important reasons to take vaginal estrogen treatment. And I like to remind people that actually we have many studies, over 20 years of data that show us that there's no increased risk of breast cancer or of blood clots in the presence of vaginally applied, which is just a locally applied hormone replacement therapy. I'm also going to touch on the fact that we have lots of different modalities to do that. We have vaginal estrogen cream and a vaginal pill. Those are things that most insurance companies want you to at least try if they don't work well enough. Then we look at doing other agents. There is a small capsule full of estrogen they can use a couple of times a week. There is a bullet-shaped waxy type of estrogen that you can use in the vaginal area. There's also a pill that selectively stimulates the vaginal estrogen receptors. And even though it's not an estrogen per se, it has an excellent effect in helping the vaginal epithelium or vaginal skin become healthier and to gain all the benefits that I just discussed. Thank you so much for your time and attention. And for those of you who are planning on having surgery, remember that I'd really like you to start the cream before surgery, no matter how long before, whether it's 1 week or 6 months. It's beneficial. The longer, the better. And after surgery, plan on starting the estrogen cream, usually somewhere between 2 and 4 weeks out from surgery. We'll have you start that cream. And it's generally considered, with rare exception, I will ask most people to take that estrogen cream or other vaginal estrogen agent that makes the vaginal tissue healthy the rest of their lives. Thank you.